time he shall consume.
Thank you, Madam Speaker. I want to thank my colleague, Representative Carter, for his work on this. He is was a small pharmacy owner before he got here, and prior to my arrival in Congress, I was actually an insurance broker for many years, a health insurance broker. And it always amazed me as pharmacy benefit managers tried to explain their business model that they actually couldn't explain their business model. And so I rise today in support of our local pharmacies and the unique role that they play in serving patients. I stand here today to commend the Center for Medicare and Medicaid Services and the recently proposed rule aimed at addressing direct and indirect remuneration, DIR fees, and drug rebates. Rebates that don't go to the consumer, but rebates that go to multi-billion-dollar corporations. I frequently make stops at local pharmacies when I'm back at my home in Georgia, and I appreciate the services that they provide their constituents. I'm from a small town, and local pharmacists are a fixture in the community, and they're the first line of defense in preventing and treating a customer's needs. They've known most of their customers in their community for many years. And I would give you one brief example. As an insurance broker, we had written a contract on a business, and the cards had not come in yet, and there's a small town pharmacy, and then there's the big chain pharmacy. And one of the employees' children had gotten sick. Guess which pharmacist was willing to work with the family to get them the medicine before the insurance card came in? And guess which pharmacist was blocked out of the plan by the pharmacy benefit managers? It was the same one, the local small-town pharmacist. I'm troubled on many of these visits because I know how these community pharmacies are finding it more and more difficult to serve their neighbors while remaining competitive in the larger healthcare marketplace. I hear from my constituents regularly about the financial burden they face as drug prices continue to climb. And the price for a drug today, when they go to get it refilled a month from now, may be totally different, and rarely is it lower. Plain and simple, we pay too much for drugs in this country. I would hope that it's something that we could work together in a bipartisan manner. President Trump has already said that he's willing to sign a piece of legislation to reduce the cost of pharmaceuticals in this country. And it's something that we should be able to come together and pass to help the American citizens and reduce the cost of health care for the American family. And most Americans assume that probably a pretty simple transaction for the pharmacist when the pharmacist purchases the drugs, even though they know it's a very complex transaction for them, never knowing what the drug is going to cost prior to going into the pharmacy. But the pharmacy transaction is just as complex, and it's anything but clear and simple. And this is because of the pharmacy benefit managers. They have used direct and indirect remuneration fees, DIR fees, to claw back money from pharmacies on individual claims long after those claims are believed to have been resolved. It means that a pharmacy doesn't know how the final reimbursement amount will be received for a claim for weeks or even months. And anyone who runs any business, healthcare business or any other business, knows you can't operate when you don't know what your reimbursement is. CMS recently proposed drug pricing rules addressing this issue head-on by requiring all pharmacy price concessions, a subset of DIR, to be included in the negotiated price, which is the price the pharmacy will be reimbursed at the point of sale for dispensing the drug. This directive would move negotiated drug prices much closer to the cost of the drug for the Part D sponsor, essentially eliminating retroactive pharmacy DIR fees. Patients win when pharmacy price concessions are included in the negotiated price. I want to commend the administration for lowering drug prices, making lowering drug prices a priority. And I want to challenge my colleagues in the Democratic Party to work with the administration and the Republicans in this House to push forward legislation that would continue to reduce the cost of health care, specifically pharmaceuticals, for the American citizen. I, along with many of my colleagues on both sides of this aisle, have advocated for these sorts of reforms that bring transparency and accountability to the system. Now, who could be against transparency and accountability? These are bipartisan issues on which we share broad agreement. I call on the leadership of this House to put the partisan politics aside, follow the lead of the administration, or walk with the administration to address the lack of transparency in the pharmaceutical industry, give pharmacies a level playing field to compete, and provide Americans access to affordable prescription drugs. This is something that we should have done for the American citizens long ago, and it's something that we can do right now. Madam Speaker, I yield back to my good friend and fellow Georgian, Mr. Carter, and I want to thank him for hosting this special order this evening and look forward to continuing to resolve this issue for the American citizens.
I thank the gentleman for his comments.